Linda Morrison seemed like the perfect nurse, attentive, professional, and well-liked by management at Sunny Hills Nursing Home. But therapy dog Bella saw something others missed. The Golden Retriever's behavior around Morrison was unlike anything her handler had seen, and when they finally understood what Bella was trying to tell them, it would shock everyone. It was a bright Tuesday morning in September when Bella, a 3-year-old Golden Retriever, arrived at Sunny Hills Nursing Home for her regular weekly therapy visits. The facility, nestled among oak trees in the heart of suburban Millfield, had been serving elderly residents for over 20 years. Its reputation for compassionate care and professional staff made it one of the most sought-after senior living communities in the area. Bella's handler, Maria Santos, had been working with therapy animals for 7 years and had never encountered a dog with Bella's intuitive understanding of human emotions. The Golden Retriever seemed to possess an almost supernatural ability to sense when residents needed comfort, companionship, or simply a gentle presence during their most difficult moments. As they walked through the main entrance, the familiar sounds of daily life at Sunny Hills greeted them, soft conversations in the common areas, the gentle clatter of breakfast dishes being cleared, and the reassuring voices of staff members helping residents with their morning routines. The facility's warm, homey atmosphere had always made these visits feel more like family gatherings than clinical appointments. Linda Morrison, a 42-year-old registered nurse who had worked at Sunny Hills for 18 months, was considered by management to be exemplary. She arrived early, stayed late when needed, and always maintained a professional demeanor that impressed both supervisors and visiting family members. Her nursing credentials were impeccable, her references glowing, and her performance reviews consistently rated her as one of their most reliable staff members. What made Linda particularly valuable to the administration was her willingness to work with the facility's most challenging residents, those suffering from advanced dementia, mobility issues, or behavioral problems that made them difficult for other staff to handle. She never complained about difficult assignments and seemed to have unlimited patience with even the most demanding patients. Director Patricia Webb had praised Linda's dedication during their last staff meeting, noting her exceptional ability to manage complex patient needs while maintaining the high standards of care that Sunny Hills was known for throughout the community. As Maria and Bella made their way down the familiar hallway toward the memory care unit, something unusual happened that would mark the beginning of a disturbing discovery. Bella, who typically walked with confident, purposeful steps and showed enthusiasm for greeting both staff and residents, suddenly began to exhibit signs of anxiety and distress. Her ears flattened against her head, her tail dropped low, and she started pulling backward on her leash, behavior that was completely out of character for the normally confident and social therapy dog. Maria noticed the change immediately, as Bella had never shown reluctance to enter any area of the nursing home during their many previous visits. "What's wrong, girl?" Maria asked softly, kneeling down to examine Bella more closely. The dog's body language suggested she was experiencing genuine fear or detecting some kind of threat that wasn't apparent to human senses. They were approaching room 127, where 83-year-old Margaret Foster resided. Mrs. Foster had been one of Bella's favorite residents during their visits over the past 6 months. The elderly woman, who suffered from moderate dementia but retained much of her gentle personality, always lit up when Bella entered her room and would spend long minutes stroking the dog's golden fur while sharing stories from her younger days. But today, instead of her usual eager approach to Mrs. Foster's room, Bella planted her feet firmly and refused to move forward. Her breathing became rapid and shallow, and she began making soft whimpering sounds that Maria had never heard from her before. From inside room 127, they could hear Linda Morrison's voice speaking to Mrs. Foster in what sounded like her typical professional tone. "Now, Margaret, we need to get you cleaned up. Stop being difficult and cooperate with me." The words themselves seemed innocuous enough, the kind of direct but caring communication that nurses often used with dementia patients who might be confused or uncooperative. But Bella's reaction suggested something was wrong. As Linda emerged from the room, Bella's anxiety intensified dramatically. The dog immediately backed away, pressing herself against the opposite wall and continuing to whimper. Her eyes never left Linda, and her body remained tense and alert, as if she were preparing to protect Maria from some perceived danger. "Good morning, Maria," Linda said with her usual friendly smile, seemingly oblivious to Bella's distressed behavior. "How's our therapy dog today?" But instead of her normal calm, welcoming response to staff members, Bella cowered behind Maria's legs and refused to approach Linda, despite the nurse's attempts to call her over with encouraging words and gestures. Over the following weeks, a disturbing pattern began to emerge during Bella's visits to Sunny Hills. Every time Linda Morrison was present in an area where Bella was working, the therapy dog would display the same anxious, fearful behavior. She would become agitated, try to position herself between Linda and vulnerable residents, and often attempt to lead patients away from areas where the nurse was working. Maria initially attributed Bella's behavior to some kind of scent or sound that might be bothering the dog, perhaps a cleaning product Linda used or a perfume that triggered an allergic reaction. She mentioned the situation casually to Patricia Webb during one of their routine check-ins about the therapy program. "Dogs can be sensitive to all kinds of things we don't notice," Patricia replied dismissively. "Linda is one of our best nurses. The residents love her, and she goes above and beyond for everyone in her care." But Maria's concerns deepened when she began observing specific patterns in how residents reacted when Linda was around. Mrs. Foster, who had always been chatty and engaged during Bella's visits, became noticeably withdrawn and quiet whenever Linda entered the room. Other residents in Linda's care section seemed more subdued and anxious than patients in other parts of the facility. Most troubling was an incident during their 4th week of visits. Maria and Bella were in the day room when Linda came to collect 87-year-old Harold Watson for his medication. Harold, who suffered from mild cognitive decline but was generally cooperative, seemed reluctant to go with Linda. "I don't want to," Harold said quietly, gripping the arms of his wheelchair. "Now, Harold, don't be silly," Linda replied with what appeared to be patience. "You know you need your medicine." But as Linda moved to unlock his wheelchair brakes, Bella suddenly positioned herself between them, gently but firmly blocking Linda's access to Harold. The dog's protective stance was unmistakable. She was trying to prevent Linda from taking Harold away. "That's strange behavior for a therapy dog," Linda commented, though her tone remained professional. "Maybe she's having an off day." Maria apologized and guided Bella away, but she couldn't shake the feeling that the dog was trying to tell them something important. That night, she researched animal behavior and found numerous articles about dogs' ability to detect human aggression, fear pheromones, and even subtle signs of violence that humans might miss. As Maria became more observant during their visits, she began noticing subtle details that painted a troubling picture. Residents who were normally eager to see Bella would become subdued and withdrawn when Linda Morrison was nearby. Their body language changed, shoulders tensing, eyes downcast, hands gripping bed rails or wheelchair arms with white knuckles. During their 5th week of visits, Maria witnessed an interaction that made her deeply uncomfortable. She and Bella were visiting 91-year-old Dorothy Chen, a former teacher who enjoyed showing Bella photos of her late husband and telling stories about their travels together. Dorothy was normally animated and talkative, but today she seemed unusually quiet and kept glancing nervously toward the door. When Linda entered to check Dorothy's vitals, the elderly woman immediately became tense and apologetic. "I'm sorry about this morning," Dorothy whispered. "I didn't mean to cause trouble." "I should hope not," Linda replied in a tone that was professional but carried an underlying edge. "We can't have residents being difficult when we're trying to help them." Bella immediately moved closer to Dorothy, gently placing her head on the elderly woman's lap in a comforting gesture. But when Linda reached to adjust Dorothy's pillows, Bella softly growled, something Maria had never heard from the normally gentle therapy dog. "Bella, no," Maria said quickly, embarrassed by her dog's behavior. But Linda's reaction was telling. Instead of the understanding response most staff members showed when dealing with animal behavior, her eyes flashed with irritation before she quickly composed herself. "Perhaps the dog is picking up on Dorothy's anxiety," she said smoothly. Some of our residents can be quite challenging. After Linda left, Dorothy seemed to relax slightly, but she remained quiet for the rest of the visit. As Maria and Bella prepared to leave, Dorothy reached out and gripped Maria's hand with surprising strength. "The dog knows," Dorothy whispered, her eyes bright with intelligence despite her advanced age. "She knows what the rest of you don't see." The cryptic comment troubled Maria throughout the week, but when she tried to follow up during their next visit, Dorothy claimed not to remember the conversation. However, Bella's protective behavior around the elderly woman continued, and Maria noticed that Dorothy always seemed more comfortable and talkative when Linda Morrison wasn't on duty. Maria's growing concerns reached a tipping point during their 6th week of visits when she witnessed an incident that convinced her something was seriously wrong. She and Bella were in the hallway when they heard raised voices coming from room 115, where 79-year-old Robert Martinez lived. Robert had Parkinson's disease and sometimes had difficulty with coordination and communication. Through the partially open door, they could hear Linda's voice, though she was speaking more quietly than usual. "Robert, I'm getting tired of your attitude. You need to learn to cooperate better, or things are going to become very difficult for you." Bella immediately became agitated, pulling toward the room and whimpering with distress. When Linda emerged a few minutes later, Robert could be heard crying softly inside the room, unusual behavior for a man who was typically stoic and rarely showed emotion. "Is Mr. Martinez all right?" Maria asked Linda. "Oh, he's fine," Linda replied with her professional smile. "He just gets frustrated sometimes when his condition makes things difficult. I was explaining to him how important it is to follow instructions." But when Maria and Bella entered Robert's room a few minutes later, they found the elderly man shaking and clearly upset. Bella immediately went to him, gently nuzzling his hand and providing comfort. Robert looked at Maria with fearful eyes. "She hurts people," he whispered so quietly that Maria almost missed it. "When no one's watching, she hurts people." Before Maria could respond, Robert quickly shook his head and refused to say anything more, as if he regretted speaking up. But his words, combined with months of observing Bella's consistent fearful reactions to Linda Morrison, convinced Maria that she needed to take action. That evening, Maria contacted Adult Protective Services and reported her concerns about potential elder abuse at Sunny Hills Nursing Home. She described Bella's unusual behavior, the residents' reactions to Linda Morrison, and the subtle signs of fear and anxiety she had observed among patients in Linda's care. The APS investigator, Janet Rodriguez, had 15 years of experience investigating elder abuse cases. She knew that proving abuse in institutional settings was often challenging, particularly when dealing with vulnerable residents who might have cognitive impairments that affected their ability to report accurately or consistently. Animal behavior can be significant evidence, Janet told Maria during their phone conversation. Dogs, especially therapy dogs, are trained to read human emotions and body language. If your dog is consistently reacting to one particular staff member with fear or protective behavior, that's something we need to investigate thoroughly. Within 48 hours of Maria's report, Janet Rodriguez arrived at Sunny Hills Nursing Home to begin a formal investigation into allegations of elder abuse. She introduced herself to Director Patricia Webb as conducting a routine quality assurance review, not wanting to alert potential perpetrators that specific accusations had been made. Janet's investigation strategy included reviewing medical records, interviewing staff members, observing patient interactions, and most importantly, speaking privately with residents who might have information about their care experiences. She also requested that Maria continue bringing Bella for therapy visits, as the dog's reactions could provide valuable behavioral evidence. During her first day of observation, Janet noticed several concerning patterns. Residents in Linda Morrison's care section seemed more subdued and withdrawn than patients in other areas of the facility. Medical records showed a higher than average number of behavioral incidents and uncooperative patient notations in Linda's reports compared to other nurses with similar patient loads. More troubling was the discovery that several residents had unexplained bruises, scratches, or minor injuries that were documented as falls or accidents in Linda's incident reports. While elderly residents were certainly prone to falls and injuries due to medications, mobility issues, and cognitive decline, the pattern seemed statistically unusual. Janet also noticed that Linda Morrison was quick to characterize certain residents as difficult, uncooperative, or confused during their informal conversations. This type of language often served to discredit potential victims and make their complaints seem unreliable. Some of these residents can be quite challenging, Linda told Janet during their first meeting. They don't understand that we're trying to help them, and they sometimes make up stories or misremember things that happened. But Janet's experience had taught her that such characterizations were often red flags. Abusive caregivers frequently portrayed their victims as unreliable witnesses while presenting themselves as patient, long-suffering professionals dealing with impossible situations. During her second day of investigation, Janet was present when Maria and Bella arrived for their weekly visit. She positioned herself discreetly in the common area where she could observe Bella's reactions to different staff members. When Linda Morrison appeared, Bella's response was immediate and dramatic. The dog became visibly anxious, moved protectively close to nearby residents, and refused to approach Linda despite the nurse's friendly attempts to call her over. Janet had never seen such a consistent, strong behavioral response from a therapy animal toward a specific individual. With Janet's gentle encouragement and assurance of protection from retaliation, several residents began sharing their experiences with Linda Morrison's care. Their stories, while sometimes fragmented due to age-related cognitive changes, painted a disturbing picture of systematic psychological and physical abuse. Dorothy Chen, the former teacher who had whispered to Maria about Bella knowing the truth, was the first to speak up during a private interview with Janet. "She's mean when no one else is around," Dorothy said, her voice trembling but determined. "She pinches and squeezes too hard when she's moving us. She says it's our fault if we cry out." Harold Watson, who had tried to resist going with Linda for medication, revealed that Linda had threatened him multiple times. "She said if I complained or caused trouble, she would make sure I got special treatment that I wouldn't like," Harold told Janet. "She said no one would believe an old man with a confused mind anyway." Most heartbreaking was the testimony from Margaret Foster, Bella's former favorite resident, whose gentle demeanor had been noticeably changed in recent weeks. With Janet's patient encouragement, Margaret described incidents where Linda had been rough during personal care, deliberately caused pain during routine procedures, and made threatening comments about what would happen to residents who caused problems. "She twisted my arm behind my back when she was helping me get dressed," Margaret whispered. "When I said it hurt, she said I was being a baby and that I needed to toughen up. She said this was what happened to people who complained too much." Robert Martinez, who had initially told Maria that Linda hurts people, provided the most detailed account of abuse. He described incidents where Linda had deliberately ignored call buttons, withheld pain medication as punishment for non-compliance, and used excessive force during transfers and personal care. "She knows exactly how to hurt you without leaving marks that other people would notice," Robert explained. "She's very careful about that. And she always makes sure it looks like accidents or normal care procedures if anyone else is around." The consistency of these accounts, combined with the residents' obvious fear of retaliation for speaking up, convinced Janet that the allegations were credible and required immediate action to protect the vulnerable elderly residents. While resident testimony was crucial, Janet knew that prosecuting elder abuse cases required additional corroborating evidence. She worked with Sunny Hill's administration to review security camera footage, medication logs, incident reports, and Linda Morrison's work schedules to establish patterns that supported the abuse allegations. The security footage review revealed several concerning incidents. While the cameras didn't capture Linda's actions inside resident rooms, they showed her entering and exiting rooms where residents were later found to be upset or injured. The timing correlations were suspicious, particularly when combined with resident testimony about when abuse occurred. Medical records analysis showed that residents under Linda's care had significantly higher rates of anxiety medication prescriptions, behavioral incident reports, and documented injuries compared to similar patients cared for by other nurses. The statistical pattern was striking enough to suggest systematic differences in care quality. Most damning was the discovery that Linda had been falsifying medication records. Several residents reported that Linda sometimes skipped giving them pain medication or gave smaller doses than prescribed, claiming they didn't really need it or were being too dependent. Cross-referencing Linda's medication logs with pharmacy dispensing records revealed discrepancies that suggested she was diverting controlled substances for personal use. Janet also arranged for a forensic interview specialist to work with residents who might have additional information but were too frightened to speak up initially. Using techniques designed for vulnerable witnesses, the specialist was able to document additional incidents of physical abuse, emotional intimidation, and neglect. Throughout this process, Bella continued to serve as an early warning system during therapy visits. Her consistent protective behavior around residents who later disclosed abuse provided additional validation for their accounts. The dog's ability to detect distress and potential danger had essentially served as a living alarm system that had tried to alert caregivers to ongoing abuse. Maria documented every instance of Bella's behavioral reactions, creating a timeline that correlated with many of the abuse incidents described by residents. The pattern was so consistent that it could not be explained by coincidence or normal variations in animal behavior. Armed with substantial evidence including resident testimony, medical record discrepancies, security footage analysis, and documented behavioral patterns, Janet Rodriguez was ready to confront Linda Morrison directly. The confrontation was carefully planned to occur when Linda was off duty and away from the nursing home, preventing any opportunity for her to intimidate residents or destroy evidence. Janet met Linda at a neutral location, a coffee shop near Linda's apartment, and identified herself as an adult protective services investigator. Linda's initial reaction was one of professional concern, asking if there were problems with residents she needed to know about. "I'm investigating allegations that you have been physically and emotionally abusing elderly residents at Sunny Hills Nursing Home," Janet said directly, observing Linda's reaction carefully. Linda's demeanor changed immediately. The friendly, professional mask slipped, revealing flashes of anger and calculation before she regained her composure. "That's ridiculous," Linda replied. "Those residents are confused and difficult. They make up stories and misremember things constantly." But when Janet began detailing specific incidents, dates, and resident testimony, Linda's responses became increasingly defensive and contradictory. She alternated between denying the incidents occurred, blaming the residents for being uncooperative, and claiming that any force used was necessary for medical reasons. "You have to understand how challenging these patients can be," Linda said, her voice rising with frustration. "They refuse medication, fight against necessary care, and sometimes you have to be firm with them. That's not abuse, that's proper medical management." Janet recognized these responses as typical of abusive caregivers who rationalize their behavior as necessary or justified. Linda's inability to show empathy for the residents' experiences and her focus on defending her actions rather than expressing concern for patient welfare were additional red flags. When Janet mentioned Bella's consistent fearful reactions to Linda, the nurse's response was particularly telling. "Dogs can be unpredictable," Linda said dismissively. "That animal probably just doesn't like me for some reason. You can't base accusations on what a dog does." But Linda's attempt to minimize Bella's behavioral evidence actually worked against her, as Janet had extensive documentation showing that Bella was exceptionally well trained and had never shown fear or aggression toward any other staff member at the facility. Based on the evidence gathered during the investigation, criminal charges were filed against Linda Morrison for multiple counts of elder abuse, fraud related to medication diversion, and assault against vulnerable adults. The district attorney's office recognized the case as an opportunity to send a strong message about protecting elderly residents in care facilities. Linda was arrested at her home and held pending trial. Her nursing license was immediately suspended, and she was banned from working in any healthcare facility pending the outcome of legal proceedings. The swift action helped ensure that no additional residents would be victimized while the case proceeded through the courts. Sunny Hills Nursing Home faced its own consequences for failing to detect and prevent the abuse. State Health Department investigators conducted a comprehensive review of the facility's policies, training procedures, and oversight systems. While the investigation found that management had not been aware of Linda's abusive behavior, they were cited for inadequate supervision and monitoring of staff interactions with residents. The facility was required to implement enhanced training programs for all staff members on recognizing and reporting signs of elder abuse, improve their background check procedures for new hires, and establish better systems for monitoring patient care and resident satisfaction. Most importantly, Sunny Hills agreed to expand their therapy animal program and train staff members to recognize when animals were displaying protective or alert behaviors that might indicate problems with resident care. Bella's role in detecting the abuse had convinced administrators that therapy animals could serve as valuable early warning systems for identifying potential issues. The case received significant media attention, highlighting the vulnerability of elderly residents in care facilities and the importance of having multiple oversight systems in place to protect them. Animal behavior experts were interviewed about dogs' ability to detect human aggression and fear, validating the use of therapy animals as monitoring tools. Several families of residents who had been abused by Linda Morrison filed civil lawsuits against both the nurse and the nursing home, seeking damages for the physical and emotional harm their loved ones had suffered. These cases helped establish legal precedent for using animal behavior as evidence in elder abuse cases. The aftermath of Linda Morrison's conviction brought significant changes to Sunny Hills nursing home and inspired reforms throughout the elder care industry. The facility invested heavily in staff training, oversight systems, and cultural changes designed to prevent future abuse and create a truly safe environment for vulnerable residents. The residents who had been victimized by Linda received counseling and medical care to address both the physical injuries and emotional trauma they had experienced. While some residents struggled with lasting effects from the abuse, many showed remarkable resilience and were grateful that their voices had finally been heard and believed. Dorothy Chen became an advocate for elder rights, speaking to family groups and care facility administrators about the importance of listening to residents and taking their concerns seriously. "We may be old, but we're still human beings who deserve dignity and respect," she would tell audiences. And sometimes it takes a dog to help people remember that. Harold Watson and Robert Martinez both credited Bella with saving them from ongoing abuse. "That dog saw what everyone else missed," Harold said during a television interview. "She knew something was wrong when the people who were supposed to be protecting us didn't see it." Margaret Foster, who had suffered some of the worst abuse, slowly regained her trusting nature with help from continued therapy visits with Bella. The bond between the elderly woman and the golden retriever remained strong, and Margaret often said that Bella had been her guardian angel during the darkest period of her life. Maria Santos and Bella became champions for using therapy animals as monitoring tools in care facilities. They traveled to conferences and training sessions, teaching other handlers and facility administrators how to recognize behavioral signs that might indicate problems with resident care. The Healing Paws Foundation, which had trained Bella, developed new protocols specifically for therapy animals working in institutional settings. These protocols included training handlers to document unusual animal behaviors and establishing communication systems with facility administrators when animals displayed protective or alert responses. Research institutions began studying the role of therapy animals in detecting abuse and neglect in care facilities. Preliminary studies suggested that well-trained therapy dogs could indeed serve as early warning systems, detecting changes in resident emotional states and identifying potentially abusive staff members through behavioral cues. 2 years after Linda Morrison's conviction, the impact of Bella's detection of elder abuse continued to resonate throughout the healthcare industry and legal system. The case had established important precedents about the value of animal behavior as evidence and the need for comprehensive protection systems for vulnerable elderly adults. Sunny Hills Nursing Home had transformed into a model facility for elder care, with multiple oversight systems, comprehensive staff training, and an expanded therapy animal program that included specially trained dogs capable of detecting distress and potential abuse. The facility's reputation had recovered, and it was now sought out by families specifically because of its commitment to resident safety and protection. Linda Morrison was serving a 12-year prison sentence for her crimes. During her trial, additional victims had come forward, and the full extent of her abusive behavior over many years became clear. Her case was used in nursing schools and healthcare training programs as an example of how trusted caregivers could exploit vulnerable patients and the importance of maintaining vigilant oversight. Bella continued her work as a therapy dog but with an expanded role as a protective services animal. She and Maria worked with adult protective services, law enforcement agencies, and care facilities throughout the region to help identify potential abuse situations and provide comfort to victims during investigations and legal proceedings. The legal system had adapted to better accommodate animal behavioral evidence in elder abuse cases. Judges and attorneys received training on interpreting animal behavior, and expert witnesses were regularly called upon to explain how therapy animals could detect danger and distress that humans might miss. Most importantly, the case had sparked a broader conversation about protecting elderly adults and recognizing their fundamental right to safety, dignity, and respect in care settings. Advocacy groups used Bella's story to push for stronger regulations, better funding for oversight programs, and more comprehensive training for healthcare workers. The residents of Sunny Hills Nursing Home lived their remaining years with greater security and peace of mind, knowing that multiple systems were in place to protect them. They often spoke about how a golden retriever named Bella had seen what others could not see and had refused to remain silent when vulnerable people needed protection. Bella's legacy extended far beyond one nursing home or one case of abuse. She had demonstrated that vigilance, compassion, and the courage to act on behalf of those who cannot protect themselves were essential components of any civilized society. Her story reminded everyone that heroes come in many forms, sometimes with 4 legs, a wagging tail, and an unshakable commitment to protecting those who need it most. The bond between humans and animals had always been special, but Bella proved that it could also be life-saving. Her instincts, training, and unwavering loyalty had given voice to those who had been silenced and had ensured that justice prevailed for some of society's most vulnerable members. In a world where elder abuse remained a serious and often hidden problem, Bella's story served as both inspiration and warning, inspiration about the power of paying attention to subtle signs and taking action to protect others, and a warning about the devastating consequences of failing to listen when vulnerable people try to ask for help. If this powerful story of Bella and her role in protecting elderly residents touched your heart, please hit that like button and subscribe for more incredible true stories about therapy animals who serve as guardians and protectors. These remarkable animals remind us that heroism comes in many forms, and sometimes the most important voices are those that communicate through pure instinct and unconditional dedication to protecting the vulnerable.